everyone. We're really excited about Dr. Mustian's upcoming presentation, but I wanted to give just a couple of quick notes. We do have another speaker. We're very excited to have Dr. Linda Cook, who will be joining us for a presentation next week on St. Patrick's Day, I believe. And so please take note of that notice that will be coming out. Your CPC leadership has been actively working on preparing for our site visit, which we're very excited to do and have over. And so that is on our radars. But other than that, we're also hearing some good news from several folks who have very favorable scores and likely funding on grants, but it's a little bit premature to make announcements. So we'll be sending those out soon. Without further ado, I'd like to introduce Dr. Karen Mustian. She's a Dean's Professor in several departments in surgery, radiation oncology, and public health sciences at the University of Rochester School of Medicine. She completed her PhD in exercise science at UNC Greensboro, and as well as has an MPH in clinical investigation epidemiology from the University of Rochester. She co-directs their cancer control and survivorship program at the Wilmot Cancer Institute, as well as playing a very important role in terms of the NCORP research base that is housed there at Wilmot. More importantly, Dr. Mustian leads the Physical Exercise and Kinesiology Laboratory, or PEAK Laboratory. She's an exercise physiologist who has a very strong portfolio of research and interventions to help people improve quality of life and make behavior changes and improve well-being following diagnosis of cancer. So without further ado, Karen, take it away.
Thank you so much, Jamie. It's a pleasure to be here with all of you virtually today. And good luck with your site visit and everything that you mentioned is coming up. We are going after obtaining our NCI Cancer Center designation, and I'm leading our CPC program here. And we just had our external advisory board meet with us, and we got glowing reviews. So we have a thumbs up to submit to NCI. So with any luck, the University of Rochester Wilmot Cancer Institute will be joining the NCI designated club within the next 18 months, which will be a real we'll be very, very happy to have that happen for us. So cross your fingers. And so what I want to talk to you today about is, I do a lot of different research in the field of exercise oncology. I've looked at things like Tai Chi, I've looked at traditional walking, resistance band training, but my true love in my work has really come to be my work with yoga. And so I'm going to spend time today talking to you about the research that I've done in yoga over the last 18 years. Actually, it's taken to do these clinical trials. They definitely don't happen overnight. And hopefully some of what I will share will give you a notion of where we can go and where we've been and where we can go in the field of supportive care and cancer control. And we'll just kind of kick it off from there.
Karen, I think your mute kicked on.
Can you hear me now?
Yep. Karen, I think your mute button has a mind of its own. It keeps kicking on.
I swear I'm not touching any buttons that make me keep muting, but I'm not liking this PowerPoint and Zoom today together. Can you hear me?
Yes, we can hear you now.
All right, I'm not going to touch anything.
We-
Let's try it.
But I don't think any of us see your slides yet.
You can't see anything?
Nope, no slides yet.
No, nothing shared.
All right, let's try this. Normally this works beautifully. All right, I'm going to cross my fingers. I can get this to. That's not gonna work. You see it?
Yes.
Perfect.
And you can hear me, right?
Yep.
All right, let's make sure it'll move. And
You
then we'll
have
do-
both thing on. Perfect.
Yeah, but it's locking up every time I do this. I apologize. I have not had this happen. And we even tested this before everybody came on.
No worries. It's just a natural phenomenon that has to occur during every presentation. And it will only appear during the first part of the presentation.
What I might have to do is share it not in full presentation mode.
That's not a problem. Karen, you could also, if you want to email them to me, I could advance your slides for you and see if I could get it to work on this end.
Let's try. So Jamie, I just emailed it to you.
Okay. If you want to go ahead and start, I'll pull it up as soon as I get it and try to catch up to you in your presentation if you'd like.
You guys see that?
Oh, yeah.
All right, so what I'll do is try to make it as big as I can. And if you, I'll go with this. Yeah, and unless you get the better version, okay?
Okay.
Apologies, everyone. Technology's great when it works, but it's not great when it doesn't work. So, okay, so start over. I'm going to talk to you about two different clinical trials that we have conducted over the last couple of decades, looking at the effect of yoga for treating insomnia and fatigue. And I'm also going to mention a couple of other side effects and toxicities that we have looked at in our work. In the first study that we launched, this was a randomized controlled clinical trial that was conducted at multiple community oncology settings across the United States. We actually conducted this in the NCI-funded Community Oncology Research Program Research Base, which is a $29 million grant that I hold as MPI from the National Cancer Institute that funds this nationwide network of community oncologists. And it allows us to conduct these huge pivotal phase 3 confirmatory trials. And so at the point in time when we launched this first study, there was maybe a little more than a dozen or so published yoga studies out there across the globe in cancer patients or survivors, but there were no confirmatory phase 3 clinical trials looking at its effects on sleep. And so we were funded by the National Cancer Institute with a grant, and we were able to also use the NCOR research-based network to conduct this huge nationwide clinical trial. We enrolled 410 cancer survivors who were post-adjuvant treatment, post-primary treatment, and they were randomized to receive either our standardized yoga intervention called the Yocast Yoga Intervention, or what was called standard survivorship care. And at the time in the US, we had not even had this sort of movement that's afoot now, where we have much more organized supportive care pipelines for people as they transition off care. So this study was begun in the day and age when you sort of finished your chemo or your radiation or surgery, and you didn't have any other follow-on therapy, and you kind of rang the bell and went out the door and you saw your oncologist every so often. And that was really the extent of what we did for survivors at that time in terms of any kind of standard of care. It was a basic randomized clinical trial with baseline assessments and post-assessments at the end of the intervention period. And I'll talk more about what that intervention actually looked like in a minute. But I want to mention that this was also a very short intervention period with yoga. It was only 4 weeks long, and we asked people to meet 2 times a week for 4 weeks. And many people who come from an exercise behavior change background, and they know my background, they're kind of stunned when they find out that I only did this for 4 weeks. And they were like, Karen, are you crazy? What are you thinking? Why didn't you do it for longer? And just to be upfront, when you're managing a toxicity like insomnia in a cancer patient, they're not willing to wait 8 weeks to get a benefit in terms of their sleep. If they have to wait 8 weeks to get a benefit, they're going to be talking to their physician and trying to get a benzodiazepine or something else to aid with their sleep. So we wanted to see if this would work, and if it would work in a fairly short amount of time to manage this clinical indication of, impaired sleep as people were transitioning off treatment. The second study that I'm going to share results with you from today is one that we actually just recently finished. We reported the primary outcome findings at ASCO, and we're in the process of publishing the manuscript as we speak, and a bunch of other manuscripts you're going to see coming out off of this trial in the hopefully not too distant future. And in this study, it was designed as a follow-on to our initial study. And in this particular study, we decided we were going to compare our yoga intervention to a very, very rigorous behavioral placebo. And our behavioral placebo was designed as a survivorship health education program. And the reason that could serve so well as our behavioral placebo is because you'll see our primary outcome in that trial was insomnia. And there was really no reason based on the literature to suspect that any of the educational information that we were giving would influence sleep, or particularly clinical insomnia. And then the third arm of that trial was pitting our behavioral yoga intervention directly up against the gold standard behavioral intervention for treating sleep, which is cognitive behavioral therapy for insomnia. So in that study, we did baseline assessments. We did post-assessments immediately post-intervention. And then we also decided to take a look at what was going on after we intervened 3 months later and 6 months later in that trial. And that trial, again, was also supported by an R01 plus our NCORP grant. And we got several other various supplements to do lots of wonderful, interesting things on this trial, which I'll be able to share with you as we go. So these are the two studies that I'll be sharing our data from. So what is our yoga intervention? And first of all, I'll start by talking a little bit about what is yoga. Yoga is a very broad term, and it means lots of different things to lots of different people. And when you do this work, it's critically important to understand any research article you read or anytime someone uses the term yoga, to actually clarify, well, what do you mean? What kind of yoga are you talking about? What system of yoga, what approach are you using here? And what we did is we decided at the time, based on what was existing in the literature, plus working with several yoga instructors, as well as our yoga consultant, who was not only a yoga instructor, but a cancer survivor and yoga therapist. And what we did is we created a standardized yoga prescription. And our yoga prescription actually includes two different types of yoga. One is gentle hatha yoga, and we use some asana, pranayama, and mindfulness activities from gentle hatha yoga. And when you look at what we did in that, these asana and the breathing and the mindfulness, you will see this present in many, many different types of yoga. So for example, you'll see these moves in vinyasa yoga, you'll see them in Iyengar yoga, you'll see them in a gentle hatha yoga class. So they are very basic, fundamental asana and pranayama exercises with mindfulness that you see in a lot of different types of yoga. We also decided to capitalize on the work of Judith Lassiter and bring some restorative yoga into what we did. And I think I think there's multiple reasons theoretically from a yoga perspective why we wanted to do that. Our 75-minute class starts with the gentle hatha, and then the latter part of the class incorporates restorative. And what we wanted to do in theory was, in our 75-minute class, we wanted to emulate a circadian rhythm profile that you would see. And what I mean by that is the first part of the class increases activity, and you can think of that as a person sort of waking up and getting going and moving during your day, whereas the latter part is of quieting activities, restorative postures to kind of relax you and use the passive support. And we really theoretically, in talking to our yoga consultants and teachers, we did this intentionally to try and emulate that rhythm so that hopefully we could promote like this idea of wakefulness and activity with rest and relaxation. We use all three components. The asanas are the postures and the movements that many of you think about when you think of yoga. And then pranayama, which are the breathing exercises that are incorporated with the postures and teaching people how to breathe with movement. And then also awareness and mindfulness activities. The yoga lasted 4 weeks. We did 2 75-minute face-to-face group sessions each week. And we strongly encouraged home practice. Everybody was given a yoga kit that included a yoga mat, a bag, a strap, and they had a manual and a DVD like this that they could take home to help them remember everything they learned in class so they could try and do it at home on their own. And we worked with a yoga consultant, as I mentioned, who was also a cancer survivor, to develop this. We hired and used only Yoga Alliance certified instructors across the US to deliver it. And we did some very brief trainings with these instructors so that they knew how to implement our standard yoga prescription. So they were not free to do whatever they wanted in any class. It was very structured. Our behavioral placebo condition in our second trial incorporated a survivorship health education program, and we based the content of that on the ASCO recommendations for cancer survivorship education and the ASCO pamphlet called ASCO Answers. This was our rigorous behavioral placebo. And if you look over here, you will see it was exactly matched to the yoga condition. 4 weeks, 75-minute group sessions 2 times a week. People were encouraged to implement all the strategies they learned at home on their own. We worked with a certified health education consultant to develop the content. We hired experienced and educated community health educators to deliver it. And again, we had standardized manuals and PowerPoints and things to use to deliver it. The 2 main components were obviously educational components, but also peer support happened a lot in these sessions. And the kinds of content that were covered were things where people were, their medical treatments were reviewed to make sure they understood them, what kind of follow-ups and medical surveillance they needed were gone over. There was discussions about survivorship challenges and ways to overcome them, and referrals to community resources. There were side effect management and rehabilitation discussions with referral to resources, and then obviously healthy lifestyle and support as well. And then the third intervention I will mention is our cognitive behavioral therapy for insomnia intervention, or CBTI. You'll see that CBTI has lots of variations out there these days, and people are even working on doing shorter versions of this. But we went with the standard gold standard level 1 CBTI, which really involves cognitive behavioral therapy that is specifically targeting insomnia. And it provides participants with sleep education information. It teaches about good sleep hygiene and how to do stimulus control, sleep restriction during the day. There's a whole variety of components under sleep hygiene. It involves a lot of cognitive behavioral therapy where there's discussions with the therapist administering the sessions about how to both think differently and behave differently so that it actually influences your insomnia in a positive manner. And there's a lot of sleep diary monitoring for patients to be able to get direct feedback and really work hard on improving their sleep habits. The gold standard for CBTI lasts for 8 weeks. It has been done in individual and group sessions, but for us, we did the traditional 90-minute group session 1 time a week for CBTI. And a lot of people say, well, why didn't you just double up and do it 2 times a week for 4 weeks? And the reason being is the way that cognitive behavioral therapy has been shown to work is over 8 weeks. And patients actually need, or participants need time to actually implement some of the strategies they learn. So we stuck with the traditional 8-week treatment course. They were encouraged to implement their strategies at home, obviously. We have a wonderful sleep consultant that worked with us to design this intervention. He's responsible for a lot of the cognitive behavioral therapy delivered all throughout the VA system in the United States. So he is very experienced and has trained many professionals to do this. We hired licensed cognitive behavioral therapy professionals to do this. And of course, we have standardized manuals and sleep diaries. So I want to take a minute to sort of talk about, so how did these survivors do with adhering to the yoga and coming to class? And we found our compliance and our adherence to actually be very good. When I first started this work, a lot of people told me that we wouldn't get survivors to actually come into any kind of center for any reason 2 times a week after they were done with their treatment. And we found that absolutely not to be true. They attended on average 6 out of 8 sessions was the total number of sessions attended. We did not force them to do any kind of makeup sessions. You know, we treated this as if it was a community-based class. And if you missed it, you missed it. We didn't worry about makeups. And we also found that 86% of all of our participants assigned to the yoga arms actually attended more than 5 of the sessions. So when you think of that and you think of your own self trying to like go exercise, you know, a couple times a week, and how often many things get in the way and how often we make it, even when we're not a cancer survivor, this is actually really good. This is the kind of adherence you hope for even in healthy individuals. What we found across in our second trial that was very interesting to us, and I may come back to this in a few minutes, is that we had fewer participants withdraw from the yoga intervention arm compared to the health education arm and the CBTI arm. And we actually had people in that second trial that said to us, and we don't think it was because the interventions were poorly done, but they really did not like going to a health education intervention, and they did not like CBTI. And that's actually one of the complaints that we see out there sometimes in our clinic, is that people want to be able to do other kinds of behaviors to help themselves. Not that they don't want to be educated, but they want to do something more than sometimes come to an educational class and sit in a room and learn and talk. And with CBTI, some of the strategies that they have to implement are really challenging. And this is for people even without cancer. So that's one of the downfalls of CBTI, is when you can get someone to do it, it actually works really well. But the challenge is to get people to do it. So our trial bared out that we actually have better adherence and attendance to our yoga than the other two interventions. And then when we looked at the feedback at the end, our survivors in the yoga arm actually in both studies found it very, very useful. 100% of them actually that were in there said that they found it useful and would recommend it to others. So it's a very patient-friendly, highly recommended intervention. So what did our data show us? And I'm providing some data and charts and things, but I'm also going to be summarizing some of this as we go, because we've learned a lot from these two trials. So the first thing that is clear is yoga improves sleep. In our first trial, we used two different measures. We used the Insomnia Severity Index and the PSQI, which is the Pittsburgh Sleep Quality Index. Both measures showed significant improvements in sleep, and that the yoga improved sleep quality. It also, in that trial, we had significant reductions in daytime sleepiness among our intervention, or among the individuals in our trial, and we had a reduction in sleep medication use among those in yoga, all compared to standard care controls. And for those of you who may have looked at that article or read it, you'll notice that the standard care controls had a little bit of improvement in their sleep quality. But what's interesting about that trial is they had just a little bit of improvement in their sleep quality. They dramatically increased their sleep medication usage over that same 4 weeks, whereas the yoga participants had a significantly better improvement in their sleep, and they reduced sleep medication use. So for those of you that are interested in this concept of polypharmacy and the use of multiple pharmaceuticals, this is a really powerful finding from that first trial, that we were able to do this without increasing sleep meds. And even when people increased their sleep meds, they didn't have as good an effect as the yoga. In our second trial, we were actually able to show that yoga was significantly better for improving insomnia compared to a rigorous behavioral placebo, which was our survivorship health education intervention. I believe that this is the first confirmatory, large, definitive phase 3 clinical trial to show that yoga is significantly better than a rigorous behavioral placebo for anything. So we are quite happy with that finding. And this really provides very, very nice level 1 evidence for the use of yoga in terms of treatment guidelines in oncology. What did we see in terms of fatigue? So what I'm sharing here is some of the results from our first trial published by Dr. Lin, who's a member of my team. And her data actually also shows that our Yokas Yoga improves cancer-related fatigue in these survivors. And if you take a look at it, you see some natural recovery and natural reduction in fatigue among the standard care controls by about 12%. But it's a 41% improvement in fatigue in the yoga participants. When you look at the pharmaceutical trials out there that have been trying to study things like modafinil and methylphenidate and all these other drugs for treating fatigue, the magnitude of effect is not even remotely close to that number. So by getting people to come in and do a 4-week, 2 times a week intervention of really, really gentle yoga, this is something virtually almost anyone can do. If you're yoga naive, it's super simple. It's very highly modifiable. We get this kind of effect on fatigue. So it's a very nice, robust effect. And I'll just mention, we were actually just going over the results this morning for submission to a conference, and sneak preview. We see very similar results in the second trial. So Dr. Lin also wanted to look at what's the relationship if I change fatigue, is that partially responsible for changing what I see in sleep, right? We always have these symptom clusters and everybody always wants to know, patients and survivors, they kind of come in, they have fatigue, they have sleep problems, they have depression, and these things all cluster together. So what is going on? And she did a nice job of looking at mediation effects with this data, and she actually found that depending on which outlook or which endpoint you're looking at, overall sleep quality or daytime naps, the changes we saw in this trial in fatigue are responsible for about 22 to 37% of the ultimate changes we see in sleep and daytime napping. So yoga is helping to decrease fatigue, and that is explaining a good proportion of what we're seeing in changes in quality of sleep and daytime napping. Actually, no, I just said that backwards, didn't I? It's the changes in sleep that are actually influencing the changes in fatigue. Sorry. Another thing that we looked at in this particular work by Dr. Lin was what is the effect of yoga for improving activities of daily living and quality of life. And what you can see here, and this is actually reverse scored, so the green bar going down actually means an improvement. She showed that we saw significant improvements in patients reporting that they could walk better, that their general levels of physical activity were better, and that their overall quality of life was better compared to the standard survivorship care. And she also wanted to look at the relationships between changes in fatigue and ultimately quality of life. And here her work actually showed that 45% of the yoga effect on quality of life occurs because we are improving fatigue. A couple of other things that we looked at that we've reported on over the years with this work is that yoga actually improves anxiety and mood. In our first trial, we saw that yoga subjects showed an 18% reduction in anxiety compared to controls who showed us very, very small 4% reduction. And in terms of mood, overall mood, the yoga participants had a 45% reduction in mood disturbances, while control subjects only showed an 11% reduction. And we expect some of that reduction to be because patients are transitioning off treatment and maybe getting better. But one of the things we've learned about side effects and toxicity profiles is that for a significant proportion of people, they will last for a long time. 6 months, 1 year, 2, 3, 4, sometimes up to 10. We've seen sleep disturbances last up to 10 years in some of our data. So these things become chronic, and without formal intervention and treatment, they won't necessarily subside back to normal levels on their own. So Dr. Papone, one of the members of our group, also was very interested in the influence of yoga among breast cancer survivors who were taking aromatase inhibitors and tamoxifen. So he pulled out the sample of breast cancer survivors on these treatments, and he looked at some side effects and toxicities that are pretty important to this group. One is muscle aches. And here you can see that the yoga participants had significant reductions in their muscle aches compared to the controls, both women on aromatase inhibitors and those on tamoxifen. Here you can also see that they had very similar results with pain. So the women who were on aromatase inhibitors and those on tamoxifen had significant reductions in their pain in the yoga group compared to the controls. And then a member of my group, Dr. Michelle Janelson's, also looked at the influence of yoga on memory and cognitive difficulties. And here is her data, her published data showing that yoga significantly reduced memory difficulty or improved memory among those participants compared to controls. And then one of the last things that I'll mention here off that trial is that yoga also changes circadian rhythms, and we measured circadian rhythms via actigraphy using behavioral rhythms to assess it. And our work actually showed that yoga participants had a stronger circadian rhythm profile with increased activity levels in the first part of the day, more maintenance of activity throughout the latter part of the day, with that expected decline into the evening in our data. So in summary, the results of that first trial were very strong. They demonstrated it's effective for a wide variety of things that we just went over. And this led us to our second trial. And actually, did I just miss? No, I think a couple of my slides got deleted. So the one thing that I probably don't have a slide in here on that I'll take a little bit of time to talk about is in the second trial, we actually did something called a non-inferiority analysis, where when we compared the yoga to the cognitive behavioral therapy intervention, because it is already effective and it's got a pretty good robust effect size, we were not interested in seeing whether yoga would be superior necessarily to cognitive behavioral therapy. We felt that if yoga was shown to be not inferior to cognitive behavioral therapy, that it would be a huge win for clinical practice in terms of cancer and oncology. And that would actually mean that we would have two very robust but very different behavioral interventions that we could be offering to patients clinically. I wish that I could report to you that the results of that showed that yoga is absolutely not inferior to cognitive behavioral therapy. That is not what our data showed. Our data was inconclusive. And unfortunately, we were only able to say that the data is inconclusive. And I'll share a little bit about how we came to that conclusion. So when you do non-inferiority analyses, you have to do two different types of sets of analysis. You have to first do an intent to treat analysis, where everybody that was enrolled and the arms to which they were enrolled, they all get included in your analyses, and you look at the results. But in order to determine true non-inferiority, you also have to look at what's called per protocol analysis. So that means you look at the people who actually did receive the prescription that you prescribed. So that means you do a second set of analyses where you go in and you look at the people who actually did the yoga that you asked them to do, did the CBTI that you asked them to do, and you compare those individuals. So when we look at intent to treat, it looks like yoga is inferior to cognitive behavioral therapy. When we do the per protocol, it's not clear. And we can't make a statement whether it's inferior, it's equal to, or superior. And other things that you're required to look at to determine non-inferiority include, were there any significant differences across these interventions in terms of uptake and adherence? Because it does no good to have a perfectly working intervention if nobody's going to use it. And what we did find was that there were significant differences between CBTI and yoga in terms of dropout and withdrawal, with patients actually stating they did not like the CBTI. And we even had people who said they would not recommend it to other cancer survivors. So with that in mind, we really don't feel like we can actually make any kind of concluding statement at this point about whether yoga is equal to, or just as good at, or maybe a little bit less effective than CBTI. The only thing that we can say is it's better than doing nothing, and it's better than a rigorous behavioral placebo, and it changes sleep for the better. It's very clear, along with all of these other side effects. So at this point, we actually do believe that there's high benefit in recommending yoga for cancer patients and survivors based on this data. And so what would we suggest? Well, there's lots of different yoga out there, and people ask me all the time. So based on this data, what should we tell patients? Well, patients can't run out and grab our yoga intervention in the community, but you can recommend people in your community to gentle hatha restorative or gentle hatha classes, and you can recommend them to restorative yoga classes, even if they're not offered in the same class together. What we do know is that the kind of yoga that you're looking for, you want it to be holistic and include all of the components of asana, pranayama, and mindfulness in those sessions. So what our data is talking about is not yoga where you're basically sitting still and doing the mindfulness components, or just the breathing exercises. And it's also not the yoga that you oftentimes get in a fitness center that's all about asana and posture and moving with no real attention to breathing and mindfulness as part of it. That's actually exercise. It's not even defined as yoga, contrary to what some fitness centers may market it as. So what kind of dose do we recommend? Well, clearly our data says that if you can do it in 60 to 75 minutes per session, that's great. And that might sound like a long time, but remember, these restorative postures in the hatha, gentle hatha yoga, it's not this, it does take some effort, but it is not like running in there and doing, it's not even close to what you experience in like a 75-minute, exercise class that you might take at a fitness center. It's a very, very different experience. We also found that on average, our participants in both trials did at least one more full day of yoga outside of class. So we're really telling people, to get the effects that we see across these trials, you probably need to try to do it about 3 times a week. Does that mean you have to do 3 times a week of 60 to 75 minutes? No, not necessarily, because that extra session, a lot of people would do it a much shorter session, like 30 minutes on their own at home. Or sometimes they might do like three days, 20 minutes. And so they would accumulate it outside of class. Intensity is actually low to moderate, is not vigorous. And the other thing I like to tell people is this is not Ashtanga yoga, which is like almost like a very aerobic type of yoga. It's not a vinyasa flow type of yoga. It's not heated yoga in a hot room of any kind. This is a normal 65-degree room, no extra heat or hotness to the room. And that's very important to note about our studies as well as the other existing yoga literature. And so what would we recommend at this point? Well, we are encouraging our oncologists and our medical providers in our nationwide network to provide information regarding the benefits of yoga for managing cancer-related toxicities to their patients. and to refer patients to qualified yoga instructors in the community who have special training, if they can, working with cancer survivors. A great way to vet that in your community is by looking for people who are Yoga Alliance certified. And what that means is they don't have to do all their training through Yoga Alliance. They can be trained all over the world at many different places and get very good yoga training. But the Yoga Alliance offers an opportunity for them to send in their materials, their training is reviewed, and they can get the Yoga Alliance certification, which kind of, if you think of it, it's kind of like medical school vetting the fact that you went to a decent medical school and your training is worth the paper that your degree is written on, right? There's also the Yoga Therapist Alliance, which actually had their certified yoga therapists across the United States that you can look for too. And I can, if anybody's interested in those organizations, you can always email me and I'll get you directly in contact with them. And then what do we say to survivors? We say, yes, try some yoga, but make sure you choose the kind of yoga that in your community that you try wisely based on what the research has actually studied and we know, not the kinds that we have not studied, which are important. And start very, very slow and gently and practice safely and progress slowly. And obviously work with very qualified yoga instructors. Talk to your physicians and doctors about contraindications to certain kinds of movement, because we can make all kinds of modifications. And here you see great modifications using chairs, which is something we used a lot in our classes with the survivors if need be. There's always blocks and blankets and wonderful things to help people through this. So I want to thank my team, and I will be happy to take some questions.
Thanks, Dr. Mustian. I appreciate that overview of that really informative science. I'm going to take the liberty of asking a first question to you while others might be interested in putting them in chat or coming on off mute and posing them themselves. But I wondered if you have data on the sustainability. How many of these folks continue to develop their own personal practice following the intervention, and if there were some longer term outcomes that were associated with that?
So in the second trial, it's the only trial that we've actually looked at 3 and 6 month follow-up data, because the first trial there were no follow-up. We weren't funded to look at anything beyond immediately post-intervention. So when we looked at the effects on sleep at 3 and 6 months later, it was sustained. And we still have very good improvements in sleep, and the data that we haven't even presented at a meeting yet. We're getting ready to send it an abstract. Fatigue looks similar for that. We also found, as you would expect with any behavior, there's always a trail off when you stop like talking to people and working with them. So we see a little bit of trail off in the yoga behavior at 3 months and 6 months. But we also, and this is an interesting thing that in retrospect, I wish I had implemented in this trial, ways to really ask patients, how much are you still doing all this like crazy sleep hygiene stuff at like 3 months and 6 months? But, hindsight's always 20/20. So we don't really have a sense of, are you still not eating in bed? Are you not watching TV in bed? Are you still going to bed at the same time every night? We don't know how well they did with that in that group. So that's actually a piece that we missed getting. And if I did this over again, I would definitely gather that kind of data. But I will tell you that the further out we went in the 3 month and the 6 month data, the yoga and the CBT groups start to get closer together in terms of their effects on sleep. And so that's one thing that also people have said, is that oftentimes, as you know, these behaviors change. And it's one thing that we need to look more into our data. Is there a way for us to even begin to look at, are people more likely to continue to try to do some yoga versus all this really challenging sleep hygiene, CBT type of behavior, when the therapists and the professionals kind of exit stage right and they're at home and living their life on their own over the next year. That's something that any study that anyone is doing should definitely be looking at, like maintenance of these kinds of effects. Very important area.
I have a question. That was an excellent presentation. My name is Sarah Purcell. I'm a postdoctoral fellow, and I study the effects of exercise on appetite in breast cancer survivors. I was wondering, so these changes that you're seeing in sleep and quality of life and fatigue, what do you think the mechanism behind that is? Is it like, changes in sympathetic nervous system? Is it changes perhaps in diet or stress? What underpins the changes in sleep that you're seeing?
So in this trial, the second trial, we actually also collected blood, and we are pursuing two underlying mechanistic pathways right now. So let me back up. Yoga and any form of movement or exercise is a fully systemic intervention, right? So even though pills tend to sometimes have systemic reactions, I like to tell people that yoga is perhaps, or a movement of any kind is perhaps one of the fastest fully systemic things you can do to a person. Because the minute you stand up out of your chair, you've just activated literally almost every cell and every organ system and every possible pathway in your body, right? So it's probably not a matter of which pathway is responsible. They're probably all responsible in many ways, different things that we can look at. But the key is like, which one is the most important, right? Which one is actually that we need to focus on, and the way that we use movement or mindfulness to affect these pathways. We're pursuing two different avenues. So we collected blood from our participants in the second trial, and we've actually we have serum, plasma, DNA, and RNA from these participants. And we are in the process right now of analyzing all of our pro and anti-inflammatory cytokines. So we're looking at sort of this like inflammation piece, right? And as you know, that can go all the way back up to being influenced by HPA axis and all of that. And then the other thing that we're looking at is the influence of the intervention on circadian phenomena throughout the body, right? And the circadian clock is really sort of controlled by the suprachiasmatic nucleus, and you have all these different peripheral clocks in your different organ systems, all the way from muscle to your heart. It's responsible for every kind of rhythm you have, right? That happens in your body, and it bears out in behavior. So you see it in the way you sleep, the way you eat, the way you move through the day. And I'm working with an incredibly talented circadian basic scientist. And if you were to ask me, I believe that it's changing it's influencing these circadian rhythms and these circadian phenomena. And that is one of the ways I believe it's influencing virtually almost every system in your body very quickly. And so we're actually going to be looking at something called circadian clock distance, which is like a genetic signature in the genes that are these genetic genes that are related to the circadian clock. And it's like a special signature. And if this signature, you can tell whether it's regulated or dysregulated compared to a healthy circadian rhythm. And so we're actually in the process of doing that right now. We're analyzing all those cytokines in the blood, and we're actually looking at these clock genes in the RNA-seq data. I wish that could be completed as fast as our patient-reported outcome data, but maybe with any luck, I think we're gonna be submitting results of that to meetings in the next maybe 6 or 8 months if we're lucky.
I'll keep an eye out. And do you have any dietary records or any questionnaires about appetite or hunger?
So we have some symptom questions about appetite and things like that in here. we did not take a long history of like eating or food frequency questionnaires or anything like that. I have two junior faculty members who are, one is a PhD nutrition scientist and one is also a background in exercise science nutrition and is a registered dietitian. And they both are clamoring to do something combining something nutritional with the yoga. And I would caution anybody who wants to do that to, I would suggest you take a look at the meta-analysis that I published in JAMA Oncology on the influence of like exercise and combination psychological interventions, because we saw something rather shocking in that trial, in that everybody thinks when you add these things together, you're going to get like an even better effect. And we didn't necessarily see that. So when we had somebody add something like a psychological intervention plus exercise intervention, if it was like this full-on huge behavior psychological, attend 2 or 3 sessions a week, it didn't work. But if you did something very focused and very intentional, like brief motivational interviewing with them, that's also a psychological intervention, it actually raised the benefit of the movement intervention. My belief is that you may find something like that with nutrition interventions. If you're trying to get somebody to focus on a clean eating diet or a Mediterranean diet or a timed eating and do this exercise thing or yoga thing at the same time, too much at one time could blow your effects on either one, right?
Mm-hmm.
But a very focused nutritional intervention, maybe where you're saying, we're going to focus on getting you more lean proteins in your diet. That's it. Or we're going to focus on, adding 2 green juices a day into what you're eating, or, or something to up your resveratrol, whatever it is that you're trying to target with your nutrition that you believe about, but make it very, very specific and very targeted if you're going to combine it with something like this. So you don't overlook.
Mm-hmm. Yeah, that's great. Thank you.
Do you have any other comments or questions? I know, Dr. Mustian, we did get one question as to whether you'd be willing to share your slides with the group, and we can follow up with you with regard to that. Any other questions, comments from folks?
Hello,
Yeah.
go ahead.
Oh, thanks. I had a question. Hi, Lisa Miller, School of Public Health. And yeah, thanks, Karen. That was a wonderful talk. I'm just wondering, given the prevalence of insomnia in adults in general and in other subgroups of adults, are you willing to make a guess about whether this is transferable to adults who are not cancer survivors?
I would make a huge educated statement to say, yes, I absolutely think it's transferable. And I think, I not only look at the yoga literature for cancer patients and survivors, but I do also try to look at other yoga literature. And I think that there's some smaller studies out there that would suggest that will help with the sleep and anxiety and whatever else it is you're experiencing. And, I'll actually share something that I experienced myself like 2 or 3 days ago, right? So everybody always assumes that because you study yoga, like you're the perfect yoga person and you always go to yoga every day. And trust me, those of us that do research in this area, we struggle with behavior just as much as anybody else does out there, right? So my yoga practice has been less than perfect during COVID, as many of you can guess. But I went to my first restorative practice class in a year. Now, I've done some yoga at home and the moving and things like that, but I actually went to my first restorative class in a year. And I realized that I was holding so much stress and anxiety just from trying, like, that you don't even realize trying to go through COVID. I realized I couldn't breathe in that class. I couldn't get comfortable in that class, all because I was like, wow, this is a lot of stress, Karen. You need to be here more often. And I came home that night and I slept the best night's sleep I've had in a year since this whole pandemic started. And I thought to myself, gee, Mustian, what are you doing? Why aren't you doing this every day, right? So when I take my own personal experiences with my practice, and I can cite many things over years as I've done yoga in different ways, but yeah, I don't think you have to have cancer to get this benefit. I think anybody can get this benefit. And, the more stress you're going through, the more important it is. And being a person that comes from a fitness background, I also will mention that until I really started practicing yoga, I never fully appreciated restorative work. And for those of you that are curious or have never, ever tried a restorative class, it is one of the most wonderful experiences. And it might be a little uncomfortable the first time or two that you do it, but if you give it a chance and try to go like 3 or 4 times before you give up on it, I think you'll find it amazing. And it is so accessible to anyone. It doesn't matter. And it's just luscious, right? These restorative practices, they're great.
Thank you.
Hi, can you hear me?
Yes.
Yeah, I'm Ravi Mahalingam. I'm a professor of neurology here, and I want to deeply, deeply appreciate your work. And I'm a molecular biologist by training, and I work with neurotropic virus infections, and having been born in India and raised in an environment where yoga is like everyday practice, I always wondered that when I looked at some of my acquaintances as I was growing up, how are they able to be, like relatively sick-free, sickness-free, and then calm and collected and everything. I always wondered as a molecular biologist, there are modern tools available to address these. And I'm so delighted to see that you are using all the tools and exploring this. So my question to you is, because I have seen that, I was trained under Krishnamacharya Yoga Mandram, Krishnamacharya Sandesikacharya, Desikachar, and the group trained me. However, there are so many people who have done this, but is there any statistics? Is there any information, although they may not have published in a country like India, where has anybody, I know there are people, scientists there too. Have you come across anybody who have collected information such as valuable as you are?
Yes. So I work with some colleagues out of SV Vyasa Yoga University, which is under Swami Vivekananda. And there are scientists there, Dr. Rao Raghavendra.
Oh yeah,
If you look up Rag's publications, he's got some really nice publications from individuals in India, and his group and the people working around him in India are publishing data from India. And take a look at some of the stuff that they're doing, because they're doing some really, really interesting stuff with neuroscience and some of those markers. Mm-hmm. Sometimes they can move a little quicker and faster in some of the things that they can do in India than we can do here. So they can move faster in certain arenas. Their resources are not always as plentiful in other areas as ours, but they're doing some very interesting stuff over there. And one of the things that I do find interesting about India in my work with my colleagues there is that I'm very happy to see the current prime minister's focus on Ayush therapies and like the role of Ayush therapies in their healthcare system nationally. And yoga is obviously one of them, right? And bringing that back, because I think we could learn a tremendous amount in the United States about some of those Ayush therapies that have a lot of good scientific evidence, right? So yoga has a very good growing body of evidence. Ayurvedic medicine, acupuncture, I think those are like the 3 top things that if we really paid attention to that, we have a lot to learn that could inform our medical system and our practices in this country. And they're doing a lot of good work with that in cancer patients
Excellent, excellent. I'm very happy. I've heard the name. I went to Vivekananda College, so I'm familiar with that. And he's a great researcher. And we are also right now working with a neem extract for COVID. We are getting very, very good result with some of the things. We would like to translate it. But anyway, thank you so much for, spending your time with us today.
That's good. Thank you.
Dr. Mustian, thank you very much. I'm going to close off questions now, but we did have a couple of those in the chat, and I'm going to send them to you via email. If you care to respond to those, at your leisure, you can. But very much appreciate your time today, and be well. And thanks everyone for coming. And hopefully we'll see you next Wednesday, also at noon, for Dr. Cook's presentation. Thank you very much.
I just want to make one comment as people are exiting, and that is to thank not only the researchers, but all the yoga instructors who are on listening to the talk today. Thank you for all the work you do.
Take care, everyone.